So, very good morning to one and all. Myself, Dr. Emil Santhosh, Department of Conservative Dentistry and Endodontics. So, what do you mean by adhesion? Adhesion is defined as state in which two surfaces are held together by interfacial forces, which may consist of valence forces or interlocking forces, or both. So, it is originated from a Latin word called adhere, in order to stick to. An adhesive is a material, frequently a viscous fluid, that joins two substrates and transfers a load from one surface to another surface. Adhesive restorative techniques currently used are in order to restore caries lesion, change the shape and color of the anterior teeth, in order to improve retention of porcelain fused to metal, bond all ceramic restoration, in order to seal pits and fissures, in order to bond orthodontic brackets, to repair existing restorations. In dentistry, bonding of resin to tooth structure is as a result of four possible mechanisms. It could be either because of mechanical or adsorption or because of diffusion or combination of above three mechanisms. Failure of adhesive joints occur in three locations, which are generally combined when an actual failure occurs. It could be either cohesive failure within the substrate, cohesive failure within the adhesive failure, or failure at the interface of substrate and adhesive. Enamel adhesion. It is inspired by the industrial use of 85% phosphoric acid in order to facilitate adhesion of paints and resins to metallic surfaces. Bunoco envisioned the use of acid in order to etch enamel for sealing pits and fissures. Various concentrations of phosphoric acid have been used in order to etch the enamel. Most currently used phosphoric acid gel have concentration of 30 to 40%, with 37% being the most common. Acid etching transforms the smooth enamel into an irregular surface and increases its surface energy. So when a fluid resin-based monomer is applied to the irregular etched surface, the resin penetrates into the surface, which is aided by capillary action. So steps for enamel bonding include: perform oral prophylaxis, isolate the tooth in order to prevent contamination from saliva and GCF, apply acid etchant in the form of gel or liquid for 15 seconds. And finally, we have to wash off the etchant, which results in the classic appearance called as frosty white appearance on drying. And finally, we have to apply the bonding agent and cure it. Monomers in the material polymerize and the material becomes interlocked within the enamel surface. The formation of resin microtags within the enamel surface is the fundamental mechanism of resin enamel adhesion. Dentin adhesion. Bonding to enamel is a relatively simple process without major technical requirements or difficulties. Bonding to dentin presents a much greater challenge. Enamel is a highly mineralized tissue composed of more than 90% hydroxyapatite, whereas dentin contains a substantial proportion of water and organic material, primarily type 1 collagen. Dentin is intrinsically hydrated tissue penetrated by maze of fluid-filled tubules. Adhesion can be affected by the remaining dentin thickness after the tooth preparation. Bone strength are generally less in deep dentin than in superficial dentin. Dentin adhesion is primarily because of the penetration of adhesive monomers into the collagen fibers, which are exposed by acid etching. Smear layer. Smear layer: whenever a tooth structure is prepared with a burr or other instrument, residual organic and inorganic components form a smear layer of debris on the surface. The composition of smear layer is basically hydroxyapatite and altered denatured collagen. So if we check the different generation for dental adhesive, first generation is basically comprised of LPG GMA. Second generation, they used a phosphate ester material. The phosphate ester material is negatively charged particle. So this negatively charged phosphate group will attach to the positively charged calcium ions in the smear layer, and the bond strength was very low, that is 1 to 5 megapascal. And in third generation, they was introduced in 1979. They used mild acids like 10% citric acid, 10% phosphoric acid, and the bond strength was 8 to 15 megapascal. Whereas in fourth generation, the concept of total edge was introduced, and it was developed in early 1990s, and the bond strength was 17 to 30 megapascal. So in fourth generation, smear layer is considered as an obstacle, so it should be completely removed. So in this three-step total edge technique, first step they've used the HN, which was completely washed off. After that, we have used the primer, which is basically a bifunctional monomer. So in this bifunctional monomer, one end is hydrophilic in nature and another end is hydrophobic in nature. And finally, we have to apply the bonding agent and cure it. And removal of smear layer via acid etching lead to significant improvements in the in vitro bond strength of resin to dentin. Application of acid to dentin results in total removal of smear layer and demineralization of underlying dentin. Demineralize intertubular and peritubular dentin and expose the collagen fibers. In fifth generation bonding agent, they have used one bottle system. Primer and bonding agent is combined in one bottle and total edge concept. And the bond strength is 20 to 25 megapascal. And in sixth generation, these were made in available in 2000. And the first total edge adhesive system include acidic etchants, which is with a concentration lower than traditional 30 to 40% phosphoric acid. Clinically, the traditional frosted appearance of enamel is just apparent. In sixth generation, the etching step is totally eliminated. Self-etching primers are moderately hydric in nature, acidic in nature. And in sixth generation, bonding agent are basically two types, type 1 and type 2. Type 1 is two components and two steps, whereas type 2 is two components and one step. And seventh generation, continuing the trend towards simplification, seventh generation was introduced, in which is basically all in one system. So what do you mean by hybridization? It is defined as the process of diffusion and impregnation of resin into partially demineralized dentin, following by its polymerization, creating a resin reinforced hybrid layer or a resin dentin interdiffusion zone. So coming to conclusion, relying bonding of resins to enamel and dentin has revolutionized the practice of operatory dentistry. Improvements in dentin bonding materials and techniques are likely to continue. However, proper attention to technique and good understanding of bonding process remain essential for clinical success.